I'm Judy Klein, president of Unity Consortium, and I'm so excited to have you participate in Adolescent Immunization Action Week. Today's conversation is an important one. Who influences young people's health choices? The new conversations about vaccines. 4 in 10 young adults today favor health advice from families and friends, and almost as many from social media. We're seeing a surge in health decisions that disregard provider advice, according to the Edelman Trust Barometer. People still do trust their doctors to tell them the truth about how to protect their health, but they trust their family and friends almost as much, according to Edelman and the Kaiser Family Foundation. All of this is having an impact on vaccination behavior. About 1 in 3 people who give their child some versus all vaccines are disproportionately and increasingly influenced by social media and other people's personal experience. So, what are the health consequences? Well, preventable disease outbreaks like what's happening now in Kent, England, with 20 confirmed cases of meningitis and 2 students having already died. HPV-related cervical, head, and neck cancers that could have been prevented. So the current and future health of young people is at stake. I'm glad you're here and welcome you to be part of the conversation. In the Q&A, please share your questions, comments, and experiences, and you'll also find relevant links throughout. So now it's my pleasure to introduce our amazing panelists. First, Dr. Margot Savoy is a fellow and chief medical officer of the American Academy of Family Physicians. Among her many roles is overseeing the educational portfolio, including health of the public and science, women's health and diversity, health equity, and global health. Dr. Jess Steier is a public health scientist and scientific communicator. She's the founder of Unbiased Science, an organization that's dedicated to communicating complex scientific concepts to the public. She's also executive director of the Science Literary Lab that focuses on empowering individuals to make informed health decisions through improved scientific literacy. And also, I'd like to welcome Dr. Liz Marnik, also a science communicator and immunologist, and the executive director of the Evidence Collective. Liz leads national efforts to offer clear, responsible, and empathetic public communication about science and health matters. Liz also shares her experience of being raised in a family that distrusted science and vaccines and brings her personal understanding of hesitancy to her work. And now I am delighted to welcome back Dr. Chelsea Clinton, Vice Chair of the Clinton Foundation, an author, teacher, passionate advocate for public health. And Chelsea uses her platform to increase awareness, spark action around issues such as vaccine hesitancy, childhood obesity, and health equity. And now, Chelsea.
Judy, thank you so much. It's so terrific to continue to be in this conversation with you over many years as we continue to kind of understand what the challenges are and also really what the opportunities are to help ensure that all families and all adolescents have the information that they need to make the right and best choices for themselves, their families, our communities. And our country. I know that we have a lot of people joining us today, and I just really want to underscore what Judy said. Please, share your thoughts in the chat and also your questions. I will do the best that I can to dual track in my role as moderator of kind of, asking our really esteemed and just excellent panelists today a set of questions, listening and learning from their answers, and then also hopefully bringing your questions into the conversation, today. I wonder if, Dr. Savoy, we could start with you, and then also, please hope that Dr. Marnik and Dr. Steier, join in. Judy spoke about many of the kind of new influences, at least new in the last, years and maybe, dozen years of kind of social media, kind of really kind of being places and spaces where kind of people go looking for information about vaccines or might be kind of the recipient of kind of narratives around vaccines. I wonder, though, if Dr. Savoy, you could kind of bring us into the pediatrician or the healthcare provider's office. How are those conversations changing when, a parent or a teen kind of walks in and it might be due for their, meningitis vaccine to kind of pick up on kind of the tragedies that Judy was sharing, from Kent or HPV or kind of any of the other vaccines that we know have for many years had questions around them, but that those questions have become all the more kind of amplified by kind of mis and disinformation and more information alike. So, Dr. Savoy, what are those conversations like?
So it's such a great question. So interestingly enough, I think we've always had conversations both in family doctor offices and pediatrician offices about what you know, what I know, and how we're going to combine that information together to get you the best outcome that you need for your life. What's different today, though, is that people have access to a lot more information. So when I was growing up, we had like that set of encyclopedias, and they were really expensive. So you couldn't just buy new ones every year. And today it feels like you get a new set of encyclopedias like every day on your phone. I mean, just right at the tips of your fingers. And so today's teenagers are armed with lots more information. So they have a lot more things to think about, but then it also means they have a lot more voices in their ear telling them about things that could be true, or it could be people trying to influence them to do something for another purpose. And so sometimes I think it's really wonderful that we have access to so much science information and we get the chance to have really good conversations about why the vaccine works or why it doesn't work or what's going to happen. The part that makes me nervous is that more and more we're getting into this odd space where people are feeling a little more polarized. And so it almost feels like we're fighting over the mind of the teenager in the exam room. And I didn't come into medicine to fight parents for their kids. I came in to fight for the kids. And so both of us are on the same side, but it's feeling more and more in the exam room like we're coming in both not trusting each other, being a little bit wary about the conversation, tiptoeing around the discussion because you don't want to upset anyone. And that's not how this is supposed to work. Like we got to be able to be open and honest and have deep conversations so that we all get that child to exactly the health outcome that they deserve and they need. And that's the part that feels the most different. So it's not the discussion necessarily. It's almost like the tone behind the discussion or the intent that's happening around the discussion that feels like it's changed a bit.
I wonder, Dr. Marnik or Dr. Steier, what your experiences are, what you're hearing from others that might kind of add to what Dr. Savoy is saying in terms of, the content, but also the kind of atmospherics around the conversations and what messaging might be resonating, with families, even acknowledging what has shifted. So, I don't know, Dr. Marnik, if you want to go first, and then, or Dr. Steier.
I think one of the hardest parts about social media, right, is that the more somebody sees these false claims circulating, the more likely they are to start to question their own, understanding. And that's one of the dangers of social media is the more you see something, the more likely you are to believe it's true. So I'm definitely seeing more, even just I have two kids myself, and in like just my normal interactions with moms in my community when they don't even know what I do, right, as my day job. I'm hearing more and more questions of like, did you hear this thing? Like, that's now circulating on social media. And like, is it true? How do I start to figure out if it's true? So I think a lot of it is just because of this information ecosystem, people who maybe wouldn't have normally had these types of questions are now wondering, are they missing something? And how do they now navigate this information ecosystem to get information they can understand and then utilize to make these types of decisions?
Dr. Steier, yeah.
Totally, totally agree. I think the algorithm is probably our biggest challenge right now. Yesterday I clicked on a video that someone sent me. Can you fact check this? Can you debunk this? Is this true? And then this morning I opened up my Instagram and I saw a video of a young woman talking about what's going on in Kent and meningitis, but then saying you don't need to get the vaccines. We have antibiotics and you could take them prophylactically. And this is what people are seeing. And once you click one video and see one video, it completely alters all of the information you're seeing. So it's a challenge, but I always remind myself, when a mother chooses not to vaccinate her child, she thinks she's making the best decision for her child. She's just a product of her information ecosystem. And our algorithms look very different than others in the general public.
So, Dr. Steier, if kind of we all acknowledge that kind of the algorithms are part of the challenge of both kind of the corrosion of trust and kind of the barriers to replenishing and sustaining that trust. What are some of the approaches that are helping? Like what is working? What are you seeing? And then curious for, Dr. Marnik and Dr. Savoy, either in those conversations with moms, and I love Dr. Marnik. I kind of view you like kind of like the espionage of like the pro-vaccines because they don't know what your day job is. Um, but Dr. Steier, like what really in your work have you seen
Yeah.
to work? And then curious, for Dr. Marnik and Dr. Savoy to chime in too.
Yeah, so I want to preface what I'm saying by sharing that I understand why many people in science and in health right now, and in this community, we're angry, we're frustrated, we're scared. I'm one of those people, right? But when we lead with that anger, I think I know that our audience picks up on that tone, and that could translate to judgment and guilt and shame. So, what works is to actually lead with our human foot forward, to lead with empathy, to say, all right, I can understand why you might think this. People are talking about this. It's all over the internet. Or reminding people that yes, I'm a scientist, but I'm also a mother. I'm a daughter. I'm an American. I actually I'm vested in this for other reasons, right? Just as a consumer of information. So I think it's difficult, but we have to stay true to that human voice. There was a great article in NPR in 2024. It was connection before correction. And that is so, so critical because if people don't trust you, they're not going to listen to you. If I can, just one more anecdote. There was a great piece published in Stat News by Dr. Craig Spencer, who's a physician scientist. You read it too. He went to a children's health defense meeting, a very vocal anti-vaccine organization, and he was so struck there was the father of one of the children who tragically died from measles last year, and he expected that the father would be so angry with the people at this organization who were part of the reason why he chose not to vaccinate his child, but instead he could not say enough about them. He was praising them, and he said, when this happened, I was at the low point in my life, and the scientists and the public health community, all they wanted to know was, did I vaccinate? Why didn't I vaccinate? And so I think we need to remember that when we don't create space for these people, they're going to go elsewhere. And those other sources do not necessarily give them good information.
Yeah, Dr. Marnik, Dr. Savoy, please. Dr.
I
Savoy.
really, really love that you jumped straight to the humanism part because I think to me that's the most important part. So everyone involved in these discussions is a human being, and therefore they're all going to have feelings. And so your feelings show up on both sides of that discussion. And if everybody can remember that ultimately their task is still focused on that adolescent or that teen person in front of them, the family in front of them, it does change the way you approach that conversation because otherwise you just get frustrated because in your mind, you're thinking, well, this science about vaccines has been proven over and over again. It's already known. I don't want to spend time fighting about that. I want to spend time talking about all these other things I know that I have for you that might be able to help your health get better. So you feel like you're wasting time. You feel like you're not getting where you need to go. But establishing trust and having empathy for the situation that the other person is going through is critically important. And it's just as important as the science side to be able to have an engaging moment and actually be able to have the person work both ways. The one thing I find really interesting about teens and adolescents, I think it's one of the reasons they're one of my favorite groups to work with, is that they are smart enough to understand, but they're emotional, so they can't always follow through. And yet we sometimes take their emotional side and we treat them like they're stupid or like they can't have an opinion or that they can't think through. And in reality, they're young adults who are learning how to think and process and understand information. And I can't think of a better space or place for you to teach them how to do some of that decision making, critical decision making, challenging, except like in a doctor's office or thinking about what people are bringing to you on social media. So instead of making it taboo to have the conversation or sort of picking on them or making them feel bad that they're listening to an influencer, we all had influencers. They just look different back when we were younger than they look today. Everybody's always had influencers. But how do you question the influencer? And how do you think about challenging what they're saying? So the same way you would challenge your parents, because we all did that too, how do you challenge what the influencer is saying? And where do you get good information? And how do you push back on your friends? And what actually is normal? Because I just remember thinking, when I was a teenager, everything seemed so dramatic. And you listen to kids now, and it's so amplified that sometimes I think they're worried about the wrong thing. They're worried about something being not normalized. And it turns out it's just a really small echo chamber that they're in that makes that not normal. And the rest of the world was actually doing exactly what they wanted to do anyway. They just needed some validation and support to get through it. So I think the real opportunity for us to help them is to be their source of reliable information, but doing it in a way where they can receive it from you, because your accuracy is only as good as they can hear you say it.
Dr. Marnik, do you want to chime in?
Yeah, I will chime in from kind of the opposite end of the spectrum. As was introduced earlier, I was not vaccinated growing up. My mom chose not to vaccinate me, and she did think she was making the best decision she could at the time. So I was raised steeped in this distrust of medical systems, of science, and how I ended up where I am today is a whole story that would take a lot more time to talk about. But I didn't end up getting vaccinated myself until I was 23. And I was about to graduate college with a bachelor's degree in science. And I was about to start my PhD, and I knew I was going to join an immunology lab. But it took me 3.5 years of being in college to finally feel safe enough to go and make that decision. And for me, it was a lot of what has already come up. It was the professors that I met who started, opening my eyes to a whole new way of thinking and understanding than the way that I was taught. It was the friends that I built relationships with who told me, they were vaccinated, and none the things that was told that would happen to me if I was vaccinated didn't happen to them. And it took a lot of time though to really like start to grapple with who could I trust? What were their motivations behind giving me this information? And then finally, bringing a couple of my friends with me to that clinic to finally go at 23 to go get vaccinated. And now when I have conversations with whoever it is that I'm talking to, I often think about what it took for me to change my mind about what I was taught. And it didn't happen quickly. And I think this is something I want to remind everyone who's here is that oftentimes when I'm talking to people who, are pro-science, pro-vaccine, they'll say, it's not worth it. I can't change anyone's mind. And I like to remind them that the goal is to plant seeds along the way and leave the door open that they can come back to you with questions and feel safe enough to not be, shamed or blamed or made fun of for having those questions. And it took me a lot of people and a lot of time to do that. And I see it happening to the people I talk to. I have a friend who I sat in a coffee shop with multiple times as they cried over their decision. They didn't know, they didn't want to not vaccinate their kid, but they were afraid to vaccinate their kid. And finally, they're now in the process of getting their kid vaccinated. But it took a long time for them to get to that point. And I think we get easily discouraged because it doesn't seem like it's working. But we have to remember that it's not going to be immediate. And the goal is to plant those seeds that might bear fruit in the future.
Dr. Marnik, I want to now bring one of the questions in because I think it's so kind of clearly is responsive, but also kind of a segue into kind of continuing, this conversation, which is the first question we actually got asked, which was a question about time. That kind of social media influencers have sort of, effectively unlimited engagement and time with the adolescents or the parents that they might be targeting or that the algorithm might be kind of, directing them toward. Whereas healthcare professionals face, as the question is framed from the person who asked it, a key disadvantage, limited time, with adolescents and families. And so, really the question is how to do that work, Dr. Marnik, that does require time, that also, what Dr. Savoy and Dr. Steier spoke to too, whether that's kind of time and space in a conversation to hold the space for kind of all the questions and the emotions that Dr. Savoy mentioned that are completely appropriate and normal for adolescents to be having, but that often take time to kind of receive and to support the kind of navigation through. And to your point, Dr. Marnik, like, time over time through those conversations. So what advice do you have about in the way that kind of this question was framed of how to compete in this space where the time differential is real?
Yeah, it's a big problem. And I think one of the things I like to when I talk to healthcare providers, my best friend is a healthcare provider, and I see how limited and how hard her job is. I like to remind them that they didn't make this problem, and it's not their job to fix this problem alone. So I see healthcare providers as one really important like part of this conversation, but also every person listening to this right now is a trusted messenger to somebody. And you can also have these conversations with people in the drop-off line at school or people around the dinner table or in the coffee shop. We can all be those trusted messengers to people. But what I will say is the way in which you have that conversation and the time you have it with a patient could make a really big difference. If you shut them down, if you make them feel shamed for having those questions, you can send them right into the arms of the people who will give them compassion and empathy, but give them false information. So I don't think you can fix it, and it's not up to you to fix it, but how you have that conversation can make a really big difference. But we all have a role to play in having these conversations with the people we care about.
I see both Dr. Savoy and Dr. Steier nodding, so I want to, Dr. Savoy, please, and then Dr. Steier.
So I think about two things. I completely agree with you that you can't fix it in the 10 minutes that you have for that office visit. But you absolutely can plant a seed and you can make connections. So you can connect the person to spaces and places that make sense, even in the social media space. So spending some time getting to know who in social media you actually do trust and the reason why. So it's not just, hey, I want you to go listen to Dr. Jess because she's really smart. I listen to Dr. Jess for X, Y, or Z reason, and this is why I find that really helpful. And did you know you could click this link and go look it up and research it and do something different? It becomes a really different conversation. So you start the conversation, but then if you really do a great job of picking your doc so that you can have somebody that you see over time, you don't have to fix it all in one visit anyway because they're coming back to see you again. That's one of my favorite parts is that they come back to see you and then we have a follow-up conversation and we see how things are going. The other side of this for me has been important because I always have to remind people, yes, I'm a doctor, but I'm also a person, which means I go out and do community service. I live in a community. I spend time with people too. And so you show up to the PTA and you show up to the Rotary Club and you show up to the church event and you answer people's questions and you show up as the authentic you, answering the questions about how you made that decision for you and for your family. And that truth and honesty of you showing up and being your own authentic self, I think makes a big difference too. And so it may not just be in the exam room. You also may be a leader in your community and in your space, and showing up consistently for people in those spaces also is a way to be able to move that forward, even if it's not during just that exam room time.
Great, Dr. Steier.
I mean, I co-sign everything that was said, but I'll add, so my husband's an emergency physician and he is a very passionate advocate for vaccines, but in his role, people are showing up, they're acutely sick, or have some issue going on. And so that's the focus, right? Obviously, there are other types of clinicians where it's not such an urgent setting, but it should not always fall on the clinician's backs. I totally agree with that. So I think that we need to get creative. Some things that I've seen, there's been some really great research. Why don't we have QR codes when people are standing in line at the pharmacy, or if they're in the waiting room at an ER or an urgent care? And by the way, that's a great place to meet people who maybe don't regularly see a primary care physician, right? If they're sitting in the waiting room and they could watch a 2-minute video from a science communicator and get this information. So we have to think creatively because we are losing the PR, and communications battle right now. The other thing I'd note, I totally agree with what Liz said, is that everyone here is a trusted messenger right now, right? So something that I think we need to focus more on is helping people we create these conversation guides. It's not just about giving people the scientific bits of information. It's actually helping them navigate the communication, right? It's a communication strategy. So when you're sitting around the table and your uncle says, oh, whatever, something about mRNA technology, you know how to navigate, because those can be really intimidating conversations. So we need to view everyone as a part of this conversation.
I want to bring kind of two questions together that we have in the chat. And I also want to say I will try to get to all the questions that we've been asked. There are two questions, one around kind of any specific communication training programs that you would recommend for healthcare professionals who I think very much want to, as I'm kind of reading into the question, you'll be able to be the trusted messenger, not only, in a clinical setting, but also in all the different places that you've all referenced, whether, in church or the Rotary Club or the, school pickup or, elsewhere. And the second is, really a question around kind of what advice do you have for communicating the risk of not vaccinating, not as a scare tactic, but just as a reality. So I want to bring those two together, and maybe, Dr. Steier, start with you, since you were just talking about communications. Any specific communication training programs you would recommend, and kind of what advice do you have for how healthcare professionals communicate the risk of not vaccinating without hopefully being scary, but being realistic?
Yeah, I think that a lot of organizations have really stepped up to the plate right now. Definitely want to give a shout out to AAFP, AAP. I see a lot of our professional medical organizations and societies. I just worked on I don't know, a two-pager with the American Academy of Pediatrics that should be coming out soon, all about, pre-bunking, how to approach these conversations. I want to maybe give a shameless plug for my organization, other organizations, the Evidence Collective, of which Liz is executive director and I'm co-founder. I think there are a lot of people who care and have the expertise, and there are a ton of materials right now that are flooding the space to help people become those trusted messengers. I see Dr. Savoy nodding.
Dr. Savoy or Dr. Marnik?
Yeah, so I think this is one of those times where sometimes this is where doctors get confused because we think you have to go to class, so that you think that you must need to go get another degree or you must need to go get another certificate or certification. And I don't know that most people need to go get a communications degree to do the conversation that we're talking about. I think what people need are examples and sometimes even scripts that they can use in language. And so I see that happening a lot in the podcast space where you're just listening to people talk. So I was only half joking about the fact that you should go listen to Dr. Jess. Like, they really do have a wonderful podcast. Todd Woolen and his group with the Trusted Messenger program have really great podcasts. And so they may not necessarily be teaching you a class that says, first you open with this sentence and then you do that sentence. But as you're listening to people describe how they're having conversations, you'll be able to find the ones that really resonate with how you communicate most naturally, and then embed and include those into the conversations that you're having. And I think that is the authentic part of it that makes the trust a little bit easier. If you just go in trying to go like, communications 101, I just remember in public health school, they did teach you communications, but if you went in that way, I don't know if that would work today. I mean, I just don't think that's the way that the world is operating. People are trusting their influencers and the other folks around them, their friends and family, because they know them, they believe that they love and care about them, and they believe that they want the best for them. That's not something you learn in communication school. That's when you learn how to be a human and relate to another human. But for some people, that requires a little bit of work because you've got to learn how to lean into how they may be thinking different than you. And so the more that you can get experience hearing other people's stories, listening to their narratives, hearing their point of view. I thought Dr. Marnik's story was really powerful to me because I think it's really brave to have to tell people, hey, I'm in this science community, but I wasn't vaccinated for a long time. And there are some judgy people in the world who might have really wanted to take her to task for that and debunk or bunk all the things that she was saying about, well, then you're not really a good scientist. I don't want to listen to you. What do you know? And yet that story and her ability to share that narrative and help you understand the thought process that she had to go through, the way she needed to think about it, helps you then approach the next person who comes, because sometimes people take that leap. Well, you must be uneducated. You must just not know. You must just not be aware. And those things aren't true for everyone. And it just gives you an opportunity to sort of think through, well, how would you have approached a person with an entire degree in science who's still looking you in the face in the exam room and saying they're not sure, or they're scared, or they're afraid? That's a very different conversation. And being prepared for that, I think, honestly, listening to people's stories and narratives and taking those in really makes me better prepared to do that, because I may not get to meet everyone in the world, but I certainly can learn about stories that help me be more adaptable and flexible as I meet the next new person who maybe I don't have that experience in my life, but I could understand them and show up for them differently.
Dr. Marnik, anything you want to add?
Yeah, I co-sign everything that they said. And I think I like to remind people, right, that people trust people more than they trust, institutions or governments or all of those things. And really being a whole person. And when you have these conversations is really important. The other thing I think is really important is to remember that to not assume the reason why somebody might be having a question. So I think that's something that, just be curious. If somebody comes to you with a question or a concern, ask them what they're thinking and where they heard it and why they're worried, and be very curious about what might be driving that. And that can actually help you be a better communicator, because then you'll actually be able to answer the question they have, not the question you assume they have. Because a lot of times we make assumptions about why somebody might be having a concern or a fear. And oftentimes my assumption is wrong when I actually sit down and have a conversation with them.
I think that's such an important point. We have a lot of questions, so I'm just going to try to continue to tend to them. And this one, Dr. Savoy, I'm going to direct to you initially, but please, Dr. Marnik and Dr. Steier, join in. So the person asking the question says, I'm an immunization manager, DSHS, for a 35 county region in East Texas, and we are still combating old myths regarding autism and how the vaccine causes the disease. And we have providers that refuse to offer HPV to their adolescent patients. So we're constantly trying to come up with new ways to engage, parents and providers. We've talked about parents, but I wonder, Dr. Savoy, if you can talk about what advice you have for Amanda, who asked the question, but anyone who is also specifically trying to help educate, fellow providers, or kind of from a state or county perspective, to help kind of inform and partner with providers in their catchment area.
So I think that's a fantastic question, and it's an interesting one. So one of the things I find most interesting in my job now is that I get to work with family docs all across the country. And I was fascinated to learn that there were family doctors who weren't really sure about vaccine. I'm looking at them like we all went to the same classes. How did you come out and you're not sure? And it was interesting because I think what Dr. Marnik said earlier is what got me through a lot of the conversations and continues to get me through. And it was getting curious about what they were actually concerned about. And it turned out that for some of them, it was really specific things. So that there was something really specific about the science or about the technology, and they really weren't sure how it worked, or they needed more information. And so you could sort of lead them to that space and help them get more information. For some of them, it was a really challenging adverse event that for them, this one person's experience with them colored the way they see every patient's experience going forward, which for doctors can be really hard because it's hard to forget the one patient who you knew, even though you might help millions of patients doing something different. That one sort of sticks in your mind and sometimes can color your perspective going forward and helping think through what that means for how we would communicate and help them think that through. But interestingly enough, some of the doctors didn't actually have an issue with the vaccine at all. What they had an issue with was fighting with parents about it or fighting with patients in general. And so, in the grand scheme of their life, when they had to choose, why would I spend money and spend time opening up a door to a fight and a conversation that I just don't want to have? And so I could move my whole day along faster if I just don't bring it up. So if I don't offer it, I don't bring it up, I no longer have to fight you. I can move on to something else and have a different conversation for a different day. And that to me was the most disheartening of them all because it means you kind of gave up. And that means that we have some work to do to help you find the ways to make that narrative a little bit different and also help you maybe open up the conversations in a way that doesn't feel like a battle every time. Because just because we don't agree doesn't mean that we have to be fighting, and not offering something doesn't remove the situation from that community. That community still needs to have a conversation because when they do get sick, they're still going to come back to you and you're still going to have to manage them. And so it doesn't completely remove the long-term discomfort, it just removes the today discomfort and helping them think about what that network looks like, reminding them that they're not on this team alone. So you're on team patient. Like there's a whole bunch of us that are all leaning in to figure out how to get what we need. And that may be the place where you do want to go have a community conversation and open up the conversation about what are we going to do? So like, I get it. You guys don't all want to be vaccinated in this particular town, and I hear you. So then what are we going to do? Because I mean, we can see that measles, for example, is taking off and people are getting sick and dying. So how are we going to navigate when we have to close schools and people can't go to work and they can't do the things they need to do? How are we going to navigate this space going forward? Because if we're going to make this one choice, it has consequences. And I think those community conversations allow the community to think about and wrestle and grapple with the consequences of the choice. It doesn't necessarily mean that they have to go back and make a different decision, but it gives them an opportunity to be engaged in the discussion. And oftentimes I find that people don't realize the consequences, which was the other part of the question you asked. Like, how do you talk to people about it without scaring everyone? I don't have to scare you that everybody's going to die tomorrow from measles, because I don't actually think everyone's going to die tomorrow from measles. I do think someone could die tomorrow from measles and they didn't have to, but I think there's other problems. So having to shut down an entire school district creates havoc for your community. The ability for people to not be able to go to work, they're not getting their education and their schooling. All of these things are problems that really create sort of ripples in our community that you can't just wipe away. Like it's not a big deal. And having that happen repeatedly because you keep having exposures could disrupt an entire school year, for example. And like that to me is really important. So how are we going to navigate those spaces as a community together? If these are the choices we're going to make, to me is one way that you have that conversation. So you're not terrifying anybody. You're not trying to scare people into doing a decision, but you are helping them think through how we're going to navigate this new space together if these are the choices that we're going to make.
I see lots of nodding along, Dr. Steier.
Yeah, so much to say. Putting on my science communicator hat, and I believe that the question mentioned the HPV vaccine in particular. This one drives me especially crazy because the head of HHS has come out to actually make the completely false statement that the vaccine has been shown to cause cancer, when of course there is absolutely nothing to support that. And in fact, the HPV vaccine is so incredibly effective that certain countries, Australia, others, have nearly eradicated, these cancers, cervical cancer and other cancers that HPV can cause. Anyway, putting a pin in that, I would say that people in general are not great at contextualizing risk. So, I'm a data scientist, so I love statistics and numbers, but not everyone does. So again, from a communications perspective, I would also say there are some really creative ways to help visualize risk. For example, data visualizations to compare the risk of the vaccine versus the risk of HPV. The other thing, I saw a comment somewhere in the thread here that someone said, we should be teaching some of these concepts early on to children. This should be part of the education infrastructure. I could not agree more. And I think, yes, there are myths like the vaccine autism myth, which simply will not die. But if we help people, if we give them some foundational, knowledge, we can effectively protect against that myth. And then, I don't know, the millions more that they'll come across on social media. So just some basic things, the dose makes the poison, and correlation does not equal causation. And, there's a difference between what we see in a rat preclinical study versus human data. Both are important, but we can't, they're not saying the same thing. Just some really critical, I think, foundational information would go a long way.
I totally agree, Dr. Sarah. I have been part of different efforts at different points in time to advocate that kind of immunization be taught at age-appropriate ways, embedded whether in life science classes or biology classes. I couldn't agree. And so maybe we collectively can resuscitate and reanimate those efforts. And want to, recognize Gordon, who kind of brought that into the conversation through the chat. I'm mindful that we only have like 15 minutes. So I'm going to try to get to more of the questions. There are quite a few questions, I think, understandably, about every level of government for local health departments, state health departments, and then we've already kind of referenced HHS. I wonder though if we can kind of have those conversations in concentric circles. And so, would be curious for all of you, kind of what advice you have, for those working with local health departments who've been accused, and as this person asked the questions, of kind of spreading vaccine propaganda, that kind of sharing risks of vaccine preventable diseases is often seen as fear mongering, while talking about the risk of vaccine injury is seen as informed consent. So what advice do you have at kind of the very local level? And then I'll kind of reference the questions for state health departments and kind of the federal level, but let's start at the local level. So Dr. Savoy, maybe.
That's a big question. So I think it's a great question. I think it's a big question. So I think for me, what's been most challenging is that I have to say something that's going to sound conflicting. So I actually do think you should still trust your public health department. I actually do think you should still trust scientists at the CDC. I also think that you can't trust everything that you read in social media that has the CDC name on it. And you can't trust everything that shows up in your mailbox necessarily from your local health department. And those two things are at war with one another because from a practical perspective, you're basically saying trust them, but don't trust them. And what I learned really early on in school, which has stuck with me all the way through life, is trust but verify. And so it's not that every single scientist is out to try to cause you a problem, but there may be a scientist that gets it wrong or that doesn't have the right information or something's not right. Sometimes there may be people who are actively trying to confuse you or create distrust. I mean, some states, just listening to the way they describe the exact same thing that I know I've read the data on, it's fascinating to watch what people can do with data. And we all know this because we see this happening with like marketing in general, right? I mean, like they could take the same fact and like either sell you a car or not sell you a car on the exact same fact, which is fascinating because people can do lots of really snazzy things. But what I do think is that you don't throw out all of it and you don't keep all of it. So that there's sort of this balance in the middle where I think taking the time to actually look at what they're sharing with you, pressure testing it against other resources and other spaces, looking for where those things line up and where they make sense. This is where I actually do think talking to your friends and family and the people that you trust to hear what they know about these sorts of things before you decide to throw it out is really important. And then when you have the opportunity to give feedback, giving them the feedback so that it may be that they weren't trying to do fear mongering, for example. They just thought you needed to know that there were certain things going on. And if their tone was off or it didn't really work for you, giving that feedback back might be really helpful to that health department. There may be people more receptive than you think, because I don't think that the institutions are themselves the institution, but they're made up of people. And those people still have interest in making sure that information comes out and goes different ways. And so I land somewhere in the middle, and I just really stick on the trust but verify. And so I wouldn't throw it all out, but I do use a lot of caution when I'm looking up stuff on the web today, because not all of those things are accurate. They're not always cited properly. But if I take the moment to double check what I'm looking at, I can feel more reassured that if I can see it in more than one space, or I can verify that it's happening in more than one place, the chances that I'm getting good information is better.
I wonder, Dr. Steier, Dr. Marnik, what advice you have for the local health department. And then also we got a question about state health departments and kind of what role do you think state health departments can play in rebuilding kind of
Yeah.
vaccine confidence. So wonder if you two can reflect on what you want to add to what Dr. Savoy said at the local level and also at the state level.
Happy to. I actually had the privilege of working at not one but two local departments of health, and I know how absolutely critical the work is there. I think, well, we've already acknowledged that right now the federal health infrastructure is not putting out great information right now. So I think a lot of it is falling to the local and state departments of health, and they have the advantage of really understanding their communities and their populations. So, I grew up in South Brooklyn. I now live in Western Massachusetts. I could tell you those are two very different communities and populations. And if I were developing a campaign to reach people, the campaigns would look very different in each of those places. Bless you. Um, That being said, I also know that our local and state departments of health are struggling quite a bit right now. They don't necessarily have the resources and the bandwidth to be putting out, these campaigns. So that's a real challenge. I think some of us are working on this and trying to figure out ways that we can repurpose some of the really great scientific content that's out there and make that available to the local and state departments of health.
Dr. Marnik?
Yeah, the main thing I'll add is I think, particularly related to the whole fear mongering thing, is I think a lot of this goes back to the risk communication that already came up, is that when anyone is making a decision about anything, right, they're maybe unknowingly, but they're still balancing those risks. No matter what we do in life, there are risks. And I think you don't stop communicating about the risks of vaccine preventable diseases just because there might be a vocal population that's opposed to that. Oftentimes, if you look, they might be a very vocal minority of your community who actually feel that way. A lot of people are just in this middle camp where they're watching and they're confused and they're curious and they need information. And those are the people really that you're trying to reach. And I would suggest one thing I think we all can do better is to be better storytellers, because stories really resonate with people when we're trying to communicate. And public health and science aren't always good storytellers, because that isn't necessarily the thing we do default, right? We love data. I love data, but stories are really motivating to people. And on the when you think about like the anti-vaccine side, they're really good at like spreading these stories that are really compelling and very scary, and can motivate people in ways that are harmful. And I think that is one thing we can think about, is like, how can we better tell stories related to the benefits of vaccines, the benefits of science, and all of these things to really humanize these concepts to help them land better with the people we're trying to reach.
A question that we got early on that I want to turn to now, and I think is such an important one that we've kind of referenced in various ways, is what advice do you have to support the conversations, I think, in clinical and non-clinical settings alike, in person and online, when the administration continues to itself promulgate and amplify misinformation around vaccines, and also with kind of federal vaccine policy in flux, particularly given the recent court ruling that effectively, vacated all recommendations from, kind of May of last year forward. So, Dr. Steier, I see you nodding. Maybe you can kind of weigh in initially, and then Dr. Savoy and Dr. Marnik.
Yeah, first of all, I'm someone who's steeped in this space, the vaccine science and policy, and even I am really struggling to keep up with everything that's happening. Every day it feels like something's happening. I would just remind people that politicians are not scientists, right? There's a lot of political theater going on right now, but this, at its core, when we're talking about vaccines, is a matter of health, medicine, and science. That it's not like there's new evidence or new data that are driving these decisions or these changes, right? And they're being implemented outside of the typical process, right? The other thing that I think people need to understand is something that's, I think, caused some problems is that when science evolves, people can often see that, as, you don't know what you're talking about, or you said this and now this changed. I think we need to do a better job as a society of helping people understand that that is a strength of science. Science is not static, right? It is an evolution. We're constantly collecting new information and new data. That is a strength, not a weakness of the scientific process. Sorry, what was I just going to say? But that has led to a whole lot of mistrust in the public. And I think when it comes to vaccines, the public should understand that in 2026, this is the most studied medical intervention in the history of the world, right? It's not like we're going to do a complete 180 when it comes to vaccine safety or efficacy at this time. So yes, we're collecting new information. Yes, we're learning new things, but the bedrock, the foundation of the importance of vaccines, that is not going to change.
Dr. Savoy, Dr. Marnik.
So one of the things I find the most interesting about what, I guess in my life, I'll call the post-COVID era, is how many people now know what the ACIP is. Like, I don't know why I find that fascinating. But like as a person who, even before COVID, I was the representative that would go to the ACIP meetings and like, I was very, very geeked out to go to CDC in Atlanta and like feel like I was doing some weird special science mission, because that's what I got excited about. But like today, to hear people talk about the ACIP, to talk about vaccine science and some of the things as though they just happened yesterday is just fascinating to me. And so one of the things I think we have as an opportunity that we could really take advantage of is that people have an interest. So that, never in my life did I think the national news was going to be running a segment on how mRNA works. I mean, like that's so cool and also very disturbing because it was in the middle of a pandemic and we all thought we were going to die and that was really scary. But if we set aside that we were all going to die part, because that part is a little bit in the past, because we've got some things that we can do to make that part better, why can't we lean into this idea of science literacy and really think about the fact that we're all getting smarter? And so the fact that we do have access to more information, the fact that we do have the ability to think and process and just understand the things around us better also gives us a responsibility. So that if we're going to be like, it's my body, it's my choice, I want to think about how I'm thinking about things, then we also have the responsibility to learn more about how our body works and what does that mean and how we want to apply things appropriately, because we still want to be able to get the best outcomes for ourselves, even as we're making the decision. And, I don't know, like back in the day, we used to study that a little bit in school, but we've got the opportunity really to teach teenagers starting really early on to think about this just differently. The idea of the scientific method, the fact that we are never satisfied with the answer. And so it tickles me that people spend so much time being worried about the safety part, because I just think about how not okay we are with even one person having a problem and us going back and looking again and tweaking and revising and looking again. And that's true for all of science. It's true for all of medicine. Vaccines is what we're talking about today. But I mean, it's just an interesting thing because it shows up across the board where people are just never satisfied. There are scientists who spend their entire career trying to get rid of that one side effect because they just want it to be the best experience for you, but that also gives you the best output. And so the idea that we have access to this information, the ability to think about it's really important. We do owe it to our colleagues and our friends and our family to make sure that they have the knowledge and skills they have to have in order to be able to understand it. And this idea about how does a vaccine get chosen is something probably people should have been talking about a long time ago. I mean, just the fact that you blindly trust people to tell you what vaccine is probably not a great method anyway. But it so turns out that we had a really solid process, and asking more questions and getting more curious about, well, why was there an ACIP and what did they used to do and how did that work? Or how did you get to that vaccine schedule? Or why would using a schedule from this country be a problem as opposed to this country? It's not the fact that we want to have the conversation that's the challenge. It's that we're not pausing for a moment to just sort of trust a little bit that maybe there was a thought put into it in the beginning. It wasn't random. It wasn't happenstance. And if we took a moment to have that conversation, I actually think we would have richer discussions, a much better overall science literacy in the country, and people could actually move forward a lot faster with a lot of the really cool things that I think are going to be coming in our future. Because as you start to take in things like AI, some of the modeling that used to take people decades to do, they may be able to do in like days or weeks, in which case science is going to evolve even faster because they're going to be able to find new, better technologies and better ways to do things. And so it's important for us to help our peers to just get better at being able to understand and acknowledge that this isn't going to be a static thing. It's never going to have just one answer and be done. Because even when we get a great flu shot, we're going to spend a whole another year trying to find an even better flu shot for next year, just like we would do with a car, just like we do with your TV, just like we would do with any other thing. And so it should be an exciting thing, not a negative thing.
I know we're almost at time, but I want to acknowledge a couple of the comments and kind of toss out a couple of the questions if you would like to engage individually or collectively. I do think it's important, someone shared kind of actually early on in the conversation that their experience is that kids today are better informed than many of their parents, and wanting to give kind of kids credit for seeking out high quality information and trying to, I think doctors avoid do exactly what you're saying, like ask good questions that are informed by kind of good information and not kind of mis and disinformation. A lot of commentary on how important it is, to your point, I think earlier also, Dr. Savoy, and kind of how we ask the question when kind of people are questioning themselves whether to get vaccinated or to have their children vaccinated. But really, you want to acknowledge a couple of the questions we haven't had the chance to get to in case, they're ones that you all would like to address. You want a question about health plan partners and what role payer partners have to kind of support, I think, just these broader conversations, if that's something you'd like to ask. A question about, how do you engage clinicians who reject kind of any anti-vaccine patients with the framing that kind of in this person's question that it hurts credibility as kind of being generally pro-vaccine and wanting, I think, as Dr. Marnik said, always to give people the chance to vaccinate their children. And then a question, I think, and I'm sorry, I can't remember which of you brought it up, but the importance of stories and how to help physicians find the right stories to hopefully, be part of informing and empowering parents and adolescents. So I just think, those are three questions we didn't have the chance to get to. And so if any of you would like to tackle any one or all three of those in our last few minutes, you would really welcome that chance. I see Dr. Steier, Dr. Savoy, all of you are nodding. So maybe Dr. Steier, I'm going to go in the order on my screen. Dr. Steier, Dr. Marnik, and then Dr. Savoy. I'm sorry if that's not the order on anybody else's screen.
Perfect. So I'll just jump into the question about pediatricians, because that is something I see come up quite a bit. People feeling like we're coercing them into getting vaccines if we, have pediatricians who will not accept patients who are unvaccinated. First, I would remind people for the reason why pediatricians often take that stance is to protect their patients, to protect the infants who are in the waiting room who are too young to be vaccinated, or immunocompromised children. So I get that. But I would also, remind folks that or pediatricians, I guess specifically, while I understand that, and I totally respect it, there is such a great opportunity to reach people, right? If you're maybe willing to just have at least one conversation with that family before you turn them away, I think that could be really quite powerful, because I am sick of seeing in my mom groups, can you recommend a pediatrician who doesn't reject, patients who won't vaccinate? So I think it presents a real opportunity.
Dr. Marnik?
Yeah, I will echo that. And I think there's a way you can both protect at-risk patients, but also keep a relationship open, because if you kick them out of the practice, they're going to go to somebody who will see them, and that might be somebody who actually would never open the conversation again, and that can be hard. I will say about the storytelling aspect, this is something that I do a lot of work in the science storytelling space. I've hold community events and those types of things too. So feel free to reach out if you want examples. The things I like to tend to remind people of is you really want to cultivate a diversity of stories, because not everyone's single experience reflects everybody's experience, right? So if your stories are only one kind of story from one kind of person, you're actually going to be missing important aspects of the conversation. So the best way to find stories, though, is to actually, particularly for public health workers, go out into the community, like your friends, your family, your community members, the people you see every day in different ways. They are great places to get stories about the impact of science and public health. Because whether or not you realize it, science and public health impact all of us. The problem is it's often invisible, and we need to do the work to make it like actually seen instead of being invisible.
Uninvisible.
Yeah, uninvisible was what I was going to say. And then I was like, I don't think that's
Why
an
not?
actual
It can be
word.
a word.
Whatever.
Why not? Dr. Savoy.
And then I'll tackle the payer question because I think it's a really great one. Honestly, the payers have been great in this space around vaccines up until now. I hope they're going to continue to be great. A lot of the professional societies have been partnering directly with the payers, thinking mostly about coverage issues. So making sure that some of the policies that were rooted very, very closely in the ACIP schedule as it was created wasn't going to create a disruption for people on the payer side as that schedule was making changes and sometimes recommending things that, for example, weren't even FDA approved to do with certain vaccines. It just was creating a lot of coverage gaps potentially and issues. And the payers worked with us as professional societies to make sure that we actually had a good discussion about why we were keeping some of our recommendations the same and what the evidence was behind ours and whether or not they'd be willing to pay for both so that even if there was going to be the change, so for example, last respiratory season, there was sort of a split, they still were paying for the vaccines that the professional societies are recommending, even if it didn't exactly align with ACIP. And that continues to be the conversation that we have going forward. And so I hope that they're going to continue to be great partners. I don't see any reason why they wouldn't, but this is one space where I think in the background, in the less sexy part of the science discussion, there's a lot of work being done sort of in the trenches to keep people aligned, to keep people prepared. Your health departments, your officials are all in these conversations and in these discussions every day, trying to make sure that people have access because not everyone even goes through a payer. Some people are needing to go through private insurance, but a lot of folks are getting their vaccines through Medicaid or other state-based programming. And so having conversations with your health departments in those spaces also becomes critically important. And I've been really proud of us as a science community for being aligned, being thoughtful, and putting the patients first to really think about what they need so that we can smooth over those gaps.
Well, Dr. Savoy, Dr. Marnik, Dr. Steier, thank you so much. And to the people whose questions we didn't get to, I'm so sorry. There are a few questions asking kind of for specific communication advice, or, how to respond to people saying, well, you told me I should trust the CDC for years, and now you're telling me to at least like be questioning it. And Dr. Savoy's heuristic or kind of specific examples of, I imagine, hypotheticals, but maybe actually questions that, providers, have heard in clinical settings or elsewhere, recognizing there are very real reasons why people might distrust kind of the medical establishment and trying to kind of tease that out from how we kind of conceptualize science. So these are all, I think, really important questions. And I'm going to be super presumptuous and say, like, please reach out to Dr. Steier and Dr. Marnik and Dr. Savoy if you want advice on how to help kind of navigate those questions in your real life. I know that we're at time, so I just want to say how grateful I am to be part of this conversation and how grateful I am to Judy and to Unity's continued work in not only convening these conversations, but kind of all the work that you do every day to help really empower kind of people who are navigating these conversations themselves, particularly adolescents, given it's Adolescent Immunization Action Week. So, Judy, back to you to please close us out.
Thank you so much to everybody. I just am so thrilled to hear your insights, your passion, and really everything you do. I'll just say, please do check out in the Q&A. We're putting a link to our solution, and trusted messengers was mentioned, and communities a number of times, and we are excited to launch the Trusted Teen Community Program. And this is all about enabling young people to own their health, shape their future, and be those trusted voices you all talked about within their communities. We have an audacious goal of educating 10,000 young people alongside 1,500 mentors. So if you're interested in being part of this, go to the link. We need all comers. And again, happy Adolescent Immunization Action Week. Thank you to Doctors Clinton, Steier, Marnik, and Savoy. You are amazing people.